To show how the coronavirus pandemic is affecting diversity in my hometown, I came here to McLeod Hospital. It's one of the two hospitals in Florence, South Carolina. This hospital kind of shows how the pandemic is affecting my community in terms of employment, for one, because originally what happened was in Florence, compared to other big cities and stuff, Florence didn't have that many cases, and so actually the hospitals were laying off workers because there just wasn't enough work to go around. A lot of people are opting out of these elective surgeries and stuff. Doctor's appointments are getting canceled, so the hospital was laying off workers. It was affecting the healthcare workers in terms of employment. But now we're seeing the cases starting to rise a lot more in the past few days. So I'm sure in the future, I can't be certain, but in terms of employment, these hospital workers are gonna have a much tougher job. The emergency room's right down there, but you can see right now there's not that many people here compared to how it normally is. At a time like this parking lot would be full, but I'm sitting in the back and there's plenty of open spots. So it just goes to show that the economy's slowing down. So employment status is probably the biggest dimension of diversity that's being affected in Florence right now. If you look behind us, it's the train station, which is that people work there, and they're obviously going to be out of work because of people not traveling. It's pretty straightforward. There's a lot of people in my hometown that are out of work because of this, and it's been rough. Hopefully things won't get too bad in terms of health care, so this hospital won't be as bad as it could be. But as of right now, it's not, and it means people are out of work. So I'll go somewhere else and talk about that. What I just showed was the main plaza of the hospital. This is the emergency side, which you can see is a lot more crowded. I guess people are freaking out because they're getting sick and thinking that maybe they have the coronavirus. And so it goes to show in terms of employment status, they're saying the healthcare system is overwhelmed, and it's likely just the emergency workers. Like I said, the elective surgeries, regular doctor's visits, things like that are not going as scheduled. But here at the emergency room, there is a lot more traffic, which is interesting to see. Downtown area of Florence, which affects diversity in terms of geographic location. I haven't really been downtown since I've been home, other than just riding through a couple times, but this is where a lot of businesses are and restaurants and whatnot. And I'm seeing a lot of activity out in the suburbs. It's a Saturday afternoon right now. I would imagine on a regular day downtown would be pretty full, but right now, as you can see, there's really nothing going on at all down here. I don't see a single person, which shows how the pandemic's affecting diversity in terms of geographic location. There's some people. People they want to stay away from areas that would be densely populated, like the downtown probably would. But out in the suburbs where I live, or in the neighborhoods, there's people out and about maintaining social distancing, but that's tougher to do downtown. So that's another interesting thing that I'm seeing while I'm riding around town thinking about this. So this building here is the church that I attend. This is showing how the pandemic is affecting diversity in terms of religion and religious beliefs. This church, my church, has not had any kind of services or church events because of the pandemic. But I know some churches are. They're using their First Amendment rights, the freedom of religion, to hold services, which that differs really from church to church, depending on people's beliefs. My church, like I said, it's not holding any services, but many of them around here are, which I think is irresponsible. My church is doing their services virtually online, which I think is the safest way to go about it during this time. This building in Florence is an adult education center. This is the Florence School District, which both show diversity in terms of educational experience, because the schools are all closed and students right now aren't getting the experience that they're used to, and it's completely changing everything in terms of educational experience. So right now we're coming up on the Carolinian nursing home, which is actually where my grandmother lives, and I'm not allowed to pull in because of the pandemic, and it shows how age is a huge factor of diversity that's affected by this pandemic. Like I said, in South Carolina, visitors aren't allowed at nursing homes right now because, as everybody knows, the elderly are the most susceptible to the virus. So I haven't seen my grandmother since I've been home, which is kind of tough. You know, she's old. You know, it's a nervous time for everybody, especially the elderly, and we can't go and see her right now, which I guess is for the best. You know, it's safe for her and the other residents, but it shows, in my opinion, age is probably the biggest factor right now with the pandemic. I'm sure when the economy goes downhill, the socioeconomic status is going to be a huge factor, but right now it's age. You know, the older people are probably the most nervous out of anybody, because we know that the virus has a much higher mortality rate for people with that of old age and with underlying health conditions. So not being able to go there is the biggest thing that I've taken from my hometown from this pandemic so far, probably because it specifically relates to me and my family, but also, you know, the virus hadn't hit here extremely hard, so there's not too much else that's all that noticeable. You know, people are still out and about doing their everyday things. There's a park that's open, has people hanging out there, but the nursing home is the biggest thing in my hometown that I see that shows how the virus is affecting this city. So that's it for age.